Hey guys, Dr. Joel here. Welcome to PCOS Part 1. In this video, we're primarily talking about what causes PCOS. In Part 2, we're going to get into how to heal from PCOS and all that good stuff. All right, let's jump into it. So PCOS obviously stands for Poly-Cystic Ovarian Syndrome. Now, real quick, I want to kind of address something here. If you're here and you're watching this, there's probably one of two things that's happening. Either number one, you've had a lot of hormone imbalances, maybe it's period issues, premenstrual symptoms, a number of different things, and you're trying to figure out like what's going on. I think this video will be helpful for you, and I'll try to differentiate what sets PCOS apart from a number of other different hormone imbalances and hormone conditions. The second likely scenario is that you've been diagnosed with PCOS and you're trying to get more information on it. You're trying to learn about maybe a holistic, natural approach to it and all of those good things. Either way, I hope you get a lot out of this video. So, PCOS, Polycystic Ovarian Syndrome, essentially what is it? It's a condition to where cysts develop on the ovaries and result in significant hormonal issues. Now, one of the things that I talk about a lot when it comes to cysts is cysts will generally come from one of two places. Number one, it can come from a hormone imbalance, which I'm going to get into here of really where PCOS comes from and kind of what causes that imbalance. Number two, a lot of times cysts develop because of parasite infections, where the body will actually wall off the parasite kind of as a protective mechanism to itself. So in this condition, however, this is hormonal driven. So when we talk about PCOS, I'm going to jump to the side here to the signs and symptoms. If you have had a number of different issues with your period or menstrual health, maybe you've had irregular periods, maybe you've have had heavy bleeding, maybe you've just had infertility. There's a number of other symptoms here with PCOS like irritability, headaches, pain, obviously significant cramping, and then here's a couple that really set PCOS apart. You have excessive body hair growth. Okay, that could be facial, that could be around the umbilicus, or as we call it, the belly button, and we could have some balding and hair thinning. Now, remember, hair thinning in and of itself is generally a sign of thyroid issues, of low thyroid function. However, if you have it with a lot of these other symptoms, there's probably a bit more going on. So one of the things I want to encourage and communicate is that if you have PCOS, PCOS is going to be different from the other hormone imbalances and hormone conditions like endometriosis, PMS syndrome, or PMS, uterine fibroids, even like cysts in the breast, things like that. Those conditions and infertility as well, they're largely going to be due to what's called estrogen dominance, and essentially that's where you just have an imbalance between the estrogen and progesterone. And I get into that more in some other videos that I'd encourage you to check out. But PCOS is different because PCOS isn't so much dependent on estrogen and progesterone. It's more revolving around testosterone. And we'll talk about why that is. But essentially, you have a couple different symptoms here with PCOS that you don't have with any other conditions. And this is what really can set this condition apart, and it kind of help explain what's going on. So with the excessive testosterone, you're going to have excessive body hair growth, and then you could even have balding, right? So you could even develop like a receding hairline and hair thinning and all these different things. Essentially what this means is you could have PCOS, and that could be the reason why your periods and menstrual cycles are so difficult and frustrating. It could be the reason for infertility and things like that. Now, how would you diagnose this if you thought that maybe you had this, or if you've already been diagnosed and you want to understand how someone gets diagnosed with this? Essentially, the standard here is you have to meet two of the following criteria. So you either have to have, number one, irregular ovulation, That just means you have to have an irregular period. So you could have a cycle that is 22 days, and then the next one is 30 days or 35 days or 40 days. And then you could skip one, and then you could go 2 months, and then you could have another one. And then that one could be 24 days, but then the next one's 36 days. So it's very irregular. And so you can have an irregular cycle, or it could be a lack of a cycle. So that's number one criteria. Number two is signs of increased androgen levels. Okay, so these are primarily your male sex hormones. And that's, again, where the excessive body hair growth and maybe even the balding is coming from, is these increased male sex hormones. The way that you would confirm this is primarily through a blood test, through lab testing. So this first one, the irregular ovulation, obviously, if you have experienced that, then you know it is what that is there. But then to check this, obviously, you'll do a blood test. The last thing that you may use, or that may be a part of this here, is an ultrasound. And that's where they'll actually be able to look to see if you have cysts on the ovaries. And usually there's a lot. It doesn't have to be on both ovaries. It can be just on one. But this is how you diagnose PCOS. So it's kind of interesting how, there's so many women that have irregular cycles. And so that one's pretty easy to meet. But I think this one's pretty important. So technically, if you have these both, then you don't even have to do an ultrasound to check for cysts on the ovaries. They're probably there. And I think that's why this diagnosis only requires two of the following. Obviously, it's nice to do an ultrasound and see if you actually do have cysts there. If you do, how many, and to what degree have they advanced, and all those different things. So as far as the basics go, guys, with PCOS, we talked about what it is. We talked about the different signs and symptoms, and primarily those male sex hormone symptoms, the excessive body hair growth, and the balding / hair thinning, that's really going to set this apart from other hormonal issues for women. So what causes, we're not going to get into that yet. We're going to talk about the 4 types. So we have insulin resistant PCOS. Okay, so that's where you have insulin resistance driving the cystic growth on your ovaries. Guys, of these 4 types, one thing I want to mention is the insulin resistant PCOS. In my experience, this is really the only the primary PCOS, if I can put it that way. You have what's called inflammatory PCOS, where you have obviously inflammation, which can come from so many places, but inflammation that drives this condition. You have post-pill PCOS, so women that stop birth control, or other types of hormonal treatments, could even be an IUD, things like that. They stop that, and then PCOS develops. And then you have adrenal PCOS, which is basically where you have adrenal insufficiency, your adrenal glands aren't functioning super well, and that leads to PCOS. I won't get into it super deep right now, but in my experience, when I'm working with patients in the clinic, and we've had multiple patients that have pretty significant PCOS, we see the high testosterone they've had. On lab work, we've seen some of the other high hormones there. They've had the ultrasound done and seen cysts there and all those different things. When we really get down to it, what I find in working with them is that the insulin resistance is by large the main issue that's driving everything. Now, what's really interesting is, obviously, if you have inflammation, you're going to have hormone imbalances and issues with your period and menstrual cycle. Same thing with stopping the pill, same thing with poor adrenal function. All of those things will affect your hormones. They'll all affect your overall periods and menstrual health. But the thing that really drives insulin, the PCOS, in my opinion, is the insulin resistance issue. So let's jump into it. What causes PCOS? So primarily high insulin is that driving cause there, okay? That leads to an overproduction in your body with high testosterone. That high testosterone is what leads to the PCOS. So what causes the high insulin? Well, when we talk about insulin resistance, obviously we're talking about, usually high blood sugar. We're talking about blood sugar imbalances and blood sugar issues. Remember, if insulin gets too high for too long, eventually that could result in type 2 diabetes. Now, a lot of people have insulin resistance, but they don't have type 2 diabetes, and maybe even they're not pre-diabetic, but they have insulin resistance. And I have other videos that get into this with the insulin and the blood sugar and all these things. But what's important to understand is you can easily check this with blood work. I think insulin costs like $10 or $20 or something like that to check. And you always want to do a fasting insulin. You also want to check glucose. You want to do a fasting glucose. And that one, again, both of those with fasting, you want to fast for at least 8 hours with no food. You can drink water, of course, but no food. That insulin, guys, we'll get into this with other videos a little bit deeper with the blood sugar. But the glucose, the insulin, hemoglobin A1C, those are some of the big ones you want to check to see where that's at. You can actually calculate your insulin resistance score. There's no lab test specifically for insulin resistance. All you do is you take the fasting glucose, you multiply it by the fasting insulin, you take that number and divide it by 405, and then that's your result there. So I get into that with other videos. I want to focus here on PCOS. So what causes that high insulin? Well, the primary things are going to be a diet high in with high carbohydrates, high carbohydrate to protein ratio. So what that means is you could basically be eating, here's your carbs, here's your protein. You can be eating normal amount of protein, but you can be eating a ton of carbs. So you have a high carb to protein ratio. You could be eating a normal amount of carbs. Which one's carbs? You could be eating a normal amount of carbs and a low amount of protein, and you have a high carbohydrate to protein ratio. So the way that you address this, obviously, is you're gonna reduce the carbs, you're gonna increase the protein. We'll talk about this in depth here in a second. Inflammation can increase insulin levels and insulin resistance. So where can inflammation come from? It can come from so many different places. It can come from eating processed foods. It can come from inflammatory seed oils, like the vegetable oil, canola oil. Obviously, we shouldn't be cooking with those things, but I also encourage people to watch out for those things because they're added in so many processed foods. And once you venture down this rabbit hole of looking at every snack that you love from the store, one of the things you realize is a lot of these foods have these oils added in. And a little bit of oil, more and more and more, is going to add more and more inflammation. So what you find is you really want to stick with whole foods. You want to cook them and prepare them yourself. And that's going to be not the easiest, but the healthiest way by far to live. And obviously, when you're healthiest, you feel the best and life is better. So we have the inflammation. Inflammation can come from other things like chronic infections. It can come from things like toxicities, high cortisol, things like that, a sedentary lifestyle. So inflammation can come from a number of places, and I get into that a little bit deeper in some other videos, but that can definitely result in that higher insulin and insulin resistance. The toxicities, you can have different toxicities. Maybe it's mold, maybe it's aldehydes, ammonia, different other hormone toxicities that can result in high insulin. High cortisol can increase insulin. So if you don't handle stress well, maybe you're not eating enough protein, maybe your cortisol is high because you've been feeling like you're in survival mode for so long, that can even increase insulin. And then of course a sedentary lifestyle can increase insulin. Now, I've had patients that come in, they have significant insulin resistance issues, but their nutrition is really good. They're not eating a bunch of carbs and sugars. They're eating really good protein. And essentially with those types of cases, if that's you, that's where there's some kind of inflammation. There's probably a chronic infection. There's some kind of toxicity or high cortisol. There's something there that's driving up that insulin. And when we address that, the insulin calms down and the body is able to balance out. So we have this high insulin. High insulin leads to high testosterone, that leads to the PCOS. So with the PCOS, again, here's all the different symptoms we already talked about. So I want to wrap this up in PCOS part 2, how to heal your PCOS naturally, of course. Check that out. We're going to get into all the good things there about how to address the insulin resistance, how to lower the testosterone naturally, and then some other different things that can help with balancing and reversing the PCOS. PCOS can be reversed, 100%. You just have to figure out what's driving a lot of the insulin resistance, how to lower the testosterone, and all those things. We're going to get into that part 2. I hope you enjoy that. Guys, let's connect. Feel free to schedule, and feel free to find us online at our different social medias. If this video has been helpful for you, feel free to leave a comment, leave a like, and then, of course, feel free to reach out if there's anything we can do to help you. Hope this has been helpful. Check out part 2, guys, and we'll see you over there.